Dear friend, I am Dr. Shekhar Srivastav, Senior Orthopedic Consultant, Sun Permanent Hospital, Delhi. Osteoarthritis of the knee joint is the arthritis which is seen in elderly patients because of wear and tear. So what happens, our knee is covered with a cartilage. Now this helps in smooth movement of the knee joint. With age or sometimes because of injury, this cartilage undergoes degeneration. It undergoes wear and tear. So as it undergoes wear and tear, the knee becomes painful. That is known as osteoarthritis of the knee joint. Osteoarthritis of the knee is mainly seen in elderly patients, both in males and females, but somehow in our country we see it more in females. I would say that almost the ratio will be almost 70 to 30%, more in favor of females. In younger persons also sometimes we see osteoarthritis if they have undergone some injury in their younger life. So there also the degeneration happens quite early and you see osteoarthritis in these patients. It's not a single factor which leads to osteoarthritis, but there are multiple factors which causes osteoarthritis. There is this genetic or familial tendency. Some persons are more prone to get osteoarthritis than others. Second is your diet. If your diet in your younger life, if your bones are weak and your calcium intake and other mineral intakes are not proper, then later on also you can get osteoarthritis. Lack of exercises is one of the major factors. The muscles around the knee joint, they are the protector of the knee joint. So if the muscles are weak, you don't get proper exercises, that puts excessive forces on the knee joint. So that can lead to early osteoarthritis. The symptoms of knee osteoarthritis, it starts with pain. Initially the pain is on walking or when the patient is getting up from sitting position or lying position. Then if the patient has to walk for long, then the patient may complain of pain. Then slowly the pain increases and the patient will have pain on each and every step. The walk also becomes unsteady. The patient walks with a wobbly gait. Then you will see that the patient is having deformed knees. The knees get bent like a bow leg. So all these are symptoms of osteoarthritis. The patient develops swelling around the knee joint, and if you examine the knee joint, it becomes tender and there is fluid inside the knee joint. These are also secondary signs of osteoarthritis. We first make the diagnosis on clinical aspect and some examination, or such as radiological examination. Clinically, you will find tenderness around the knee joint. There will be swelling around the knee joint. When you move the knee joint, you will feel that it is not moving smoothly, but there is some crepitus while moving, and there will be tenderness around the knee joint. Then we send the patient for x-rays. On x-rays, it becomes quite clear osteoarthritis. The x-rays will show that there is some bony overgrowth, and the normal structure, normal architecture of the knee is deformed. Usually starts with medicines and exercises. As we know that the muscles around the knee joint are the protector of the knee joint. So we first start with strengthening of these protectors or the quadriceps muscles. So the patient is sent for physiotherapy. He is taught some exercises and we tell them to perform these exercises regularly. The patient is also given some medications which can be in forms of analgesics, and there are some arthritis modifying agents also which we give to them. We take care of their calcium, vitamin D levels, and then we send them for some physiotherapy, hot packs. All these are symptomatic measures. Later on, when it becomes more severe, then we can give them some brace which unloads their knee joint, and so the pain is less. Major or advanced cases of osteoarthritis, the treatment is surgical. Now, surgery can be in form of either arthroscopy, where we make only small holes through which we clear the debris inside, But if the arthritis is quite severe, in that cases we go for total knee replacement.